Obstetrical nursing. What is an obstetrics nurse? Also known as an OB nurse or perinatal nurse, an obstetrics nurse specializes in women's health and reproduction. They help women during an exceptional time in their lives, caring for them from preconception through post-delivery. Depending on work environment, care can be given from as early as puberty through menopause. Obstetrics nursing emerged in the United States at the end of the 19th century in response to many social movements. Prior to this, it was common for childbirth to take place in the home. Potential work settings: hospital maternity wards, obstetric and gynecology private practices, community clinics, family planning centers, private birthing centers, and midwife practices. Areas of work include well women and prenatal care, labor and delivery, and postpartum. Characteristics and skills of an OB nurse include communication skills, emotional stability, attention to detail, organizational skills, critical thinking skills, patience, and compassion.
Nurses in prenatal care. What is prenatal care? Prenatal care is a type of preventative health care. Its primary goal is to provide regular checkups that allow nurse midwives to treat and prevent potential health problems throughout the course of the pregnancy and to promote healthy lifestyles that benefit both mother and child. The term prenatal means from conception to birth. These nurses also provide care during and after the delivery. What type of nurses work in prenatal care? Nurse midwives, perinatal nurse practitioners, perinatal nurse specialists, and perinatal nurses. A nurse's role in prenatal care is to help mothers who are expecting to avoid and recognize health problems that might be present before, during, or after birth. The specialists aid the mothers in learning and implementing healthy habits during pregnancy. Prenatal nurses are empowered to promote healthy habits among new mothers. These professionals assist primary care providers in promoting healthy outcomes for gestating mothers and newborn babies. They also help women understand and cope with the changes they will experience during pregnancy and childbirth. A nurse midwife is a nursing specialization that deals directly with pregnancy, labor, and postpartum concerns. As a nurse midwife, you'll work with the mothers to ensure their safety during the childbirth process, as well as the safety of their newborn child. Nurse midwives in many ways offer similar care to that of an OB/GYN doctor. Where do prenatal nurses work? Prenatal nurses work in hospitals, birthing centers, community centers, adult education centers, and physicians' offices. Benefits of prenatal care. During this period of pregnancy, nurses help the parents learn how to maintain the health of the mothers and their entire family. During prenatal visits, care providers continually assess the growth and development of the fetus and monitor for health complications that might cause issues during childbirth. Prenatal diagnosis also help medical professionals pinpoint pre-existing health problems that pregnancies might occur. Bureau of Labor Statistics estimates that job growth for nurses, including prenatal nurses, will be significantly higher than other occupations. The demand for registered and specialized nurses in perinatal care is generally high because there are labor shortages in metropolitan and rural areas.
Labor and delivery. A good L&D nurse should be very compassionate, warm, and empathetic. They go from having one patient to 2 or more and must be accommodating to their patients. L&D nurses. They place IVs, they check on the dilation, they make sure mom is comfortable and that she has enough energy for when it is time to push, and they also keep an eye on all monitors, including the baby's heartbeat. L&D nurses also coach mom to push through her contractions. They keep an eye on the monitor, and when she is having a contraction is when she is supposed to push. So the nurse, a good nurse, will make sure that she is encouraged to do that. And then once the baby is delivered, the nurse will take the baby and go do the Apgar scale and clean up the baby. L&D nurses also help clean up mom after delivery. This includes giving stitches if she needs it, helping clean up and making sure she's still comfortable and ready to invite her baby and hold him or her. To make a good L&D nurse, he or she will make sure the new family is adjusting to their new life. He or she will take care of them until they go home. He or he will make sure mom is healing and baby is doing good and is able to feed. They also will help mom make all necessary appointments to follow up on her and baby. He or she will also be reassuring by answering any and all questions that mom and dad will have.
Postpartum nursing. The postpartum period is considered the time right after the mother gives birth. In this time period, the mother's hormone levels and the size of the mother's uterus will go back to its pre-pregnancy state. Normally, this recovery period is about 6 weeks after birth. According to the World Health Organization, the postnatal or postpartum period is the most critical yet the most neglected phase in the lives of mothers and babies. A postpartum nurse is the person who cares for both the recovering mother and the newborn infant. In most big hospitals, there's a special unit where the mother and the baby go after delivery. In smaller hospitals, the unit where the actual delivery takes place is exactly where the recovery will be as well. Postpartum nurses specialize in how to care for new mothers and educate them on how to care for their newborn babies. A postpartum nurse must attend to both the physical and the emotional health of new mothers due to their hormone levels being elevated and trying to return to a normal pre-pregnancy level. Postpartum nurses must be caring and gentle. Their jobs are during a very sensitive time in this new mother's life. These nurses are trained to care for mothers who are recovering from both natural births and cesarean sections. Postpartum nurses provide important physical and emotional care and recovery for both the new mom and the newborn baby following a delivery. They are trained to monitor vital signs, assess any incisions, give pain medication, and educate the new mother with caring for their little ones. They are trained to teach the new mother to watch for signs of postpartum depression and may work in tandem with a lactation consultant to assist with breastfeeding. Postpartum nurses are very compassionate and patient due to the emotional state of these mothers.
How do you become an OB nurse? First, you must obtain at minimum an associate's degree in nursing, and you must pass the NCLEX, also known as the National Council Licensure Examination for Registered Nurses. You must meet experience and employment requirements and also pass the certification exam. The NCC offers certification in a number of specialties and even subspecialties like electronic fetal monitoring. Continuing education and or re-examination may be required in order to maintain your certification.